Hope everyone is keeping warm. It's definitely dropped in temperature where I am in Hamilton. My name's Linda. I am a community service coordinator for Hamilton. I'm also a mother to two beautiful children, and the topic that we're talking about today is keeping winter bugs at bay, and it's definitely something that I can relate to right now with one of my kids sick. So this chat with Roscelyne has come at the most perfect time. And I'll pass you on to Roscelyne now.
Thank you, Linda. Kia ora, everyone. My name is Roscelyne, and I'm a PlunketLine nurse. I have been working with Plunket for odd 7 to 8 years now, I think. And I have been a well child nurse since then. Um, Prior to this, I have also worked in other hospitals and care home facilities. I was born and raised in the Philippines, but have been a nurse here in New Zealand for almost 12 years now. I usually host the live chats, but voila, I'm now in the hot seat today. Yeah, a bit of a change, but it's good.
Oh, well, we're glad to have you. Awesome. So not only an experienced nurse, but a mother as well. So it'll be awesome to have a little bit of a chat. So before I begin, we actually do have some prize packs from our amazing sponsor, Dettol. There's actually two. So if you want to go in for the draw to win that, you need to comment in the comments section. Maybe a bit of a question. I'm sure this topic of obviously winter bugs, people have got lots of questions. So please do pop a comment, and our producers in the back will choose some to read out, and hopefully we can answer some questions for you. So yeah, two prize packs. In the prize packs, we've actually got quite a bit. There is Dettol bar soap, 3 of them. Antibacterial floor wipes, 3 of those as well. Liquid hand wash, 2 of those. Sanitizers, 4 of those, and some multi-purpose wipes, 1 of those. And we got 2 of those big packs. So if you did want to have a look-see to see what's actually in those, if you follow us on Instagram, there's a wee photo. They've popped up in stories as well. So yeah, give us a comment, bit of a question, and we'll draw that at the end. Yeah, so we'll get into it then. Obviously, it's winter. There's lots of bugs flying around, especially when you've got children, daycare, all sorts, school. I guess probably to start off with is why do we get more bugs, or they seem more common during the winter time? Do you have any thoughts around that, Roscelyne?
I think for some, like research says, there are also like illnesses can be quite common in the winter. As our body goes actually into hibernation mode. I didn't realize that whilst I was reading, and like not just human beings, say like every living thing in the earth, we have the tendency to fight against it, even when there's that natural rhythm that guides nearly all life on earth. But we are faced now with, of course, we know darker mornings, overcast days, and early sunset, and it becomes more tempting to just hunker down under your duvet instead of getting out and about early in the morning. But I think it's because also that we're quite close and cramped up during winter. We breathe the same air, like what you said, Linda. Kids get sick all the time. They bring bugs at home, and yeah, and the air gets warm and humid inside the house. So that's when we definitely share all those bugs and viruses that's lurking around the corner. Yeah.
Yeah, that makes total sense. And I guess we're probably a little bit less reluctant to, we're more reluctant to open up the windows as well. It's so cold, and
Too cold.
the house kind of breathe.
Exactly. Yeah.
Yeah. And then so, obviously they are around. We do want to prevent them, but if they do happen, what are the top kind of bugs that we're seeing in winter, or illnesses that we're seeing?
Yeah, I guess it all starts with your snuffles, say like you're sneezing, you've got this trickling, trickling sensation on your throat, or colds usually. So colds, flus, other respiratory illnesses are quite common in colder months. And because people, were more indoors often, we allowed viruses to pass more easily from one person to the other. Um, And of course, that cold air and that dry air may weaken our resistance. And also, that low temperature can increase the likelihood of getting sick. And, our bodies, they're not as effective at fighting viruses when cold air enters our nostrils or the upper airways. So, the viruses
Mm.
such as your common cold, snotty nose, runny nose, the flu, and of course, COVID, it's still there, can often spread more easily in the winter. But of course, not just colds. Later on, you'll never know, it develops into a cough or something else. Yeah.
Totally. Yeah. And it does, you're right. It does
Yeah.
totally just start off with like a little bit of a funny throat
Trickle.
thing, especially in
Yeah.
the mornings. Yeah. It can take you a little while to get up. Oh, awesome. So we've got the colds, you mentioned flu, COVID. Are there any ones
Mm.
that might progress from there? So let's say you wake up with a bit of a cold and then a couple of days in,
Yeah.
you're doing your basic treatments at home and then it progresses into something a wee bit worse. Would that then turn into RSV, or what are
Or
the
something else.
what
Yeah.
are the harsher ones for
Yeah. I think so. Say that starts with colds, right? So usually colds, I'd probably touch a wee bit on each of those, Linda, if it's okay. Sometimes the colds, they can last for 1 to 2 weeks. However, with colds, if it's just colds, just you can sometimes end up having some bacterial infections, or
mm,
like sinus infection, which then you may become unwell longer, thinking that, oh, it's just probably colds. But yeah, there's the tendency to get worse rather than just the normal colds. Um, and sometimes that common colds can then develop into a bit of a cough. We hear some parents ringing us at PlunketLine asking, "Oh, my baby just started having runny nose, and then after a few days they started coughing." In actual fact,
mm,
they can sometimes be related. Because we've got that one. I guess I can describe it as one tube connecting our eyes, our ears, our nose, and our throat. So that one tube connecting can sometimes infect each other if it's more kind of related to virus, or sometimes it may not. So that's why it's quite common for us to sometimes have like runny nose, runny eyes, ear infection, or blocked ears, blocked nose, and sometimes your throat itches and hurts. So those are some of the few things that can go alongside just a common cold. And
yeah,
of course, you'll never know because viruses, there's quite different strains of viruses, let alone COVID and flu. So there's quite a few things that can, of course, make a cold worse than just a common cold. Um, and we're talking about like
mm,
flu earlier. And so the flu or the influenza, again, that's sort of, caused by different strains of viruses as well, but almost the same symptom as your common cold. Like it all started as a common cold anyways, and then they
yeah,
started developing quite differently as you get on, like especially if your immune system is really quite low or quite down. um
mm,
Sometimes it tends to get quite worse than just the common cold or flu. Now with the RSV, of course, it is also quite common, quite a common virus in winter season, even in spring months, especially here in Aotearoa. Um, and it's a very it's one of the many viruses that can cause infections of the respiratory tract. Again, parts of the body that's related to breathing. So more like a breathing or respiratory infection. Now, of course, we would
mm,
not know whether it's RSV or not unless we get it properly diagnosed by a GP. Yeah.
yeah. So most of them start off with a bit of a cough and things like that, and then they
Mm,
they may progress, and then I guess, especially Emmy, for us and our kids, when do you then
mm.
know maybe I should go see someone for this? It's
Yeah,
getting to a couple
exactly.
of days in, or yeah, like what are
Mm,
those
mm.
things that we're going to look for in our peppy to go, okay, let's go head to the doctors, the urgent care, and get a look at this.
I look at this. Yeah.
Mm.
So quite a few things to consider is that if your puppy is under 3 months old, and they have started developing very high temperatures. They're not feeding very well, or they're not having wet nappies as usual. Their behavior is quite different to normal. They're just very lethargic or drowsy or very unresponsive to you as parents or caregivers. Then, of course, that's when we would seek medical attention with our GP. Or
Mm.
if you are not sure, at PlunketLine, we do have assessments over the phone, similar to our colleagues in Healthline. So if people are really worried or concerned, or you're just not sure when to take them in, you can actually give us a call at PlunketLine, and we'd be more than happy to run through that health assessment over the phone. Yeah.
Awesome. I know for myself, I have used them quite a few times.
Good.
And it's very handy, the 24/7 line.
Yeah, for sure. I have used PlunketLine myself as well with my two kids. So yeah,
Yeah, it's
yeah,
probably one of the best little magnets with the number that you can have when you have your children. So just for reassurance as well, especially when you have your
yeah,
first one. But that's
absolutely.
awesome. Thank you for all that info.
Mm,
Now, if it's just the start, just a bit of a cough and you're not feeling too bad or you're not having too many concerns, what are the
mm,
things that we could do as parents or caregivers at home to just kind of keep them comfortable if you don't have
mm.
too many issues and it's not quite at the stage of bringing them into to a doctor?
Yeah, yeah. As what we always say, I guess, Linda, prevention is better than cure, right? But you can't get away from bugs and viruses all the time, even if you've been really, really quite, keeping well yourselves, like me, the nurse. It's also got a bit of a snuffle, keeping it real. Yeah, I think it's more really, your basic hygiene. Um,
Mm.
we probably learned this the hard way since COVID, but your good hand washing, which I'm pretty sure would be able to pop in on the link later. We've got a very good video on hand washing, just a bit of a reminder to everyone. Um, and also looking after yourself, of course. It's easier said than done, like what I said earlier, to hunker down under the sheets, not have enough exercise, eat your proper meal, boost your immune system, not just with over the counter medications or vitamins. We've got fruits, in your veggies, all of those things that can help boost your immune system as well, and also our pippy, of course, because as parents, we're not allowed to get sick, aren't we? We always look after our tamariki. We're not allowed to get sick, so we have to look after
Yeah.
ourselves, because who's gonna look after them if we're also sick? Yeah.
Yeah,
Mm.
definitely. I mean, that's a good point that you touch on as well. I know even for myself, when you're a bit under the weather, but then you have to
Mm.
look after your kids that are also under the weather. It is,
Yeah.
it is tricky and it is tough, and I'm sure there's so many other people that have been through that, and there's days that are a bit
Mm.
long, and you're looking for just those moments to kind of refresh yourself and um, I guess for myself, looking after sick kids is, you
Mm.
put them first, and then once they're off to bed and as comfortable as they can be, I try and get
Mm.
a longer shower in when everyone's in bed and put some music on and
Absolutely.
try and refill your cup a bit because it can be some long days if you're looking after your
Mm.
peppies that are also under the weather. So, do you have any tips, Rosalind, that you do as a mum yourself to kind of get by those
Mm.
days if you're looking after your sick kids or anything?
Yeah, no, absolutely, Linda. I think some of the things that I have learned, apart as a nurse, it's hard for me not to sort of self-diagnose, unfortunately. But sometimes, the things that you learn as a nurse can sometimes be quite conflicting if you're a mom as well.
Mm.
Some of the things that I've tried doing myself, and also the things that I've been giving advice to callers, which are also based from, of course, Ministry of Health, and some studies. Of course, making sure, that, for example, if we're talking about like cold symptoms, some of the things that we have tried which worked are, of course, you've mentioned about showers earlier, it's actually quite good
Mm.
uh, info about showers, because knowing that the steam in the shower can also help unblock nasal passages. So you might be doing yourself a favor there, Linda, when you're having those long showers,
Yeah.
by unblocking your nasal passages if it's really quite blocked. And also for babies, that
Mm.
can also help. Not meaning that you need to shower your baby, but if someone's having a shower, like mom or dad's having a shower in the bath, that steam in the bathroom can actually help unblock those nasal passages and
Mm.
congestion. Um, Over the counter, yes, I know that there's quite a few that you can get out there, but just be mindful of what are the treatments or medication that you are going to give
Mm.
Peppy. Always check with your GP first, or check with the pharmacist, because we know that pharmacists can now give some advice and guidance on what would be a good sort of, a good treatment or remedy for common ailments or illnesses that's lurking around. Yeah.
Mm. Sorry to interrupt you, Rosalind. We do have a question from one of our
Oh, great.
viewers, and I'm apologising if I don't pronounce this right, Carolyn. Hopefully, I got that right. She has asked, "Is a room vaporizer actually good? If so, which brand would you recommend?" So this kind of touches on what we were talking about. I thought
Mm,
it would be good.
perfect timing. Thanks for that question, Carolyn. Um, Room vaporizers, I would say I'm a bit of a neutral on this. Some parents would say they're actually quite good because it helps unblock nasal passages. Same as
Mm.
what I was mentioning to Linda earlier about your steamy bathroom or hot showers. So it kind of is like that when it comes to the mechanism of action of vaporizers. Um, and unfortunately, with brands, I cannot recommend any brand in particular. Um, yeah, like I said, I'm just on the sort of neutral when it comes to vaporizers. They're good in some ways because it helps them block and clear the passages, and also it would depend on how old is your little one, who's going to be using the vaporizer. Yeah,
Mm.
if you're looking at vaporizers, Carolyn, best to check the product, the description, because I'm pretty sure it will say there what would be appropriate for age as well. Yeah.
Yeah. Awesome.
Mm.
That's a great question, though, because
Thank
yeah,
you.
I do. You do see them quite often around, and well, there's lots of products around, and sometimes
Mm.
you're a little bit overwhelmed. You're thinking, do I get this for Pepe, or what
Mhm.
do I do? Especially, at the chemist, there's so much different things. So, yeah, that's awesome. So, um, in terms of home remedies, we've touched on, steaming and things like that. Is there anything else, like, let's say your Pepe has a fever? Is there any home remedies when you're at the
Yeah.
start of it that you could do, like obviously flanneling and thin clothing, but anything else
Mhm.
that you would recommend as a PlunketLine nurse, Rosalind?
Yeah, again, when it comes to fevers, Linda, of course, we would want our PP to be nice and comfortable when it comes to them if they've got a
Mm.
fever. Like if you have experienced fever yourself, it's not pleasant, eh? Like you just want to be lying in bed, sleeping, more often than not under the sheets. However, as tempting as it may be, let's
Mhm.
lessen their clothing, like what you've said, minimal clothing layers, make sure that the room temperature is nice and cozy. So between 18 to 20 degrees Celsius inside the room if you can. If you've got, a thermostat, so you can, get that 18 to 20 degrees sorted. Not too hot, not too cold temperature for Peppy. Um, I'll just touch base with the flanneling as well, Linda, because some research had already given us
Mm.
that has been passed on. We don't encourage sponging the whole body with tepid water
Yeah.
because yes, it cools them down quickly. However, we are only cooling the peripheral or the outer the
Mm.
outer body temperature. But in reality, their
Yeah.
inner or their core temperature remains hot. So if they're cooled down too quickly, the tendency is that core temperature might spike up, which can lead to
Ah.
an increase of your inner or core temperature. So sometimes they might say, I've already taken my baby in the shower, in the bath. After that, her temperature spiked up to 39. So that's what causes that. Although we have been
Right.
doing that before. I'm pretty sure we
Yeah.
have been doing that before. But with research, I think that's what came up. So we don't advise that. But if little ones would allow you, um, a cool damp cloth on their forehead is okay.
Mm,
Yeah.
okay. Yeah. That's good
And
to
lots of
know.
fluid. Yeah.
Yeah. Yeah.
Mm.
And if I think with fluid as well, especially younger ones, sometimes if they're not feeling the best, they might kind of
Yes.
push it away and reject it. And I guess, is there any tips to get as much fluid as you can into them? It's a bit of a tricky
Yeah,
one.
it is. It is definitely, Linda. And I've experienced that myself with my
Mm,
baby before he's had RSV. It's so hard to get them to drink if they're really, really unwell. Um,
yeah.
but if moms are breastfeeding or if you're bottle feeding, giving them some formula, they're starting to refuse that. Try as much as you can to give them small, frequent sips. You'll never know that 5 mils of fluid can actually go a long way. So, for example, your baby just keeps on refusing the fluids. You offer 5 mils now, and then 5 mils after 15 minutes, and you're gradually building that up in,
Yeah.
in an hour or so. Um, and depending on their age, of course, we know that certain age of peppy, they have different fluid requirements. If you're not
Mm,
sure how much does my baby actually need, again, you can call us at PlunketLine, and we would be very happy to give you some more guidance on that question.
yeah.
Yeah.
Oh, that's perfect.
Mm.
I know I have a 1 year old and a 7 year old. And I know for my
Yeah,
7 year old, um, even little things like having a special straw when she's sick that has cute little things
exactly.
on it to go, you get to use this
Yes.
now, and little sips. So it's quite funny what you end up doing as mums. But we've had a
Yeah.
couple of questions come through about
Hmm.
daycare bugs, and that's something I can definitely relate to with my youngest being one in daycare. It probably feels like for most people that it's just revolving. You get
Yep.
your Peppy is sick for a week and then back at daycare for 2 days, and then there's something else. And so
Hmm.
I guess a lot of the questions the producers have put up is about possibly if there's things that we can do to minimize, or it's pretty hard to prevent, but to minimize
Yeah.
daycare bugs kind of keep spreading.
Mm. What I'd
Yeah.
like to say is debug. So we know that kids, or our pepi tamariki, they go to daycare like what you said. They come home, they bring all the bugs and whatnot. So we need to debug, like our computer. We need to debug our computer every now and again if they have got virus or threats. So same is true with ourselves or with our tamariki. Making sure that rather than entertaining the bugs or the virus in our system, let's debug them. So when I say debug, like wiping off places that you touch more often if you know that you're already sick, loading yourself up with lots of vitamin C so you know that you are protected with your immunity, not just the vitamin C that you buy from the pharmacy, the supermarket. Fruits itself contain heaps and heaps of vitamin C, and your veggies. um and again, in saying that, of course, little ones are quite hard to get vitamins and minerals through your veggies and fruits. um but also making sure that you know basic hand hygiene, really, I think that goes a
Mm,
long way. Basic hand hygiene goes a long way in keeping bugs at bay. Like our nose, our mouth, the tear ducts in our eyes and our ears, those are the things that usually bugs entertain, or where bugs reside, or where they're quite happy residing at. So if we really, really are quite good at keeping those clean and sanitized and all that, good hand hygiene, basically, all of those things will go
yeah.
a long way in keeping ourselves well. Yeah.
Right. And that's perfect. And the YouTube video that we talked about before with the link that one of our producers put up, that's actually really catered to children. So you can actually show that, the viewers can show that to their kids. And I mean, my 1-year-old, he's still quite young, but as many people know, they're like sponges. And so I guess if we are doing the hand washing next to them and encouraging them, and hopefully they will start to understand that, you
Yeah,
know, it's the happy birthday song, and it's this
that's
is
right.
how we do things. And yeah, so that YouTube clip is catered to children. So if all the viewers wanted to show their kids, that might kind of encourage some good hand washing. But that's awesome. And yeah, just wiping down
Mm,
surfaces, and yeah, that's perfect. We have another kind of topic or question,
mm,
which kind of links up to this, Roscelyne, about some parents have asked about supplements, probiotics,
mm.
vitamins, things around that for our younger kids. So let's say under, 14 or 10 to 14 months, they've kind of put there. I mean,
Okay.
like you said, obviously nutrition and getting those fruits
Mm,
and vegetables and our immunity naturally is the best thing. But
mm,
if parents are wanting a little bit of a top up and they are thinking about that, is there any kind of guidelines around that, do you think?
mm, mm. I think for very younger tamariki, especially
Mm.
the I'd say the under 1 year old, usually as registered nurses, we cannot recommend any of this supplements, vitamins, probiotics. You'll have to either, of course, check again with the GP if they would be able to recommend anything specifically for your tamariki or pepe's age. Um, Although sometimes it's okay for them to have this supplements, vitamins, or probiotics as long as with the guidance from a medical professional, whether it's from the GP or from the chemist, which are actually more kind of um, wealth of knowledge when it comes to, supplements, vitamins, and probiotics. Yeah.
Right. Yeah. Okay. That's
Mm.
awesome. Yeah, and there is so much on the market, and so yeah, I think
Yeah.
going in and having a real good um look around and talk to, like you said, the pharmacist, and then
Pharmacist.
make your own decision from there, which is awesome. Talking about the pharmacist, I was
Mm.
hoping to maybe touch on possibly something our viewers didn't know, which I only recently found out about,
Mm.
the MSA, which is the minor service ailments, isn't it? MSA,
That's right.
minor
Yes.
ailments service. That's it.
MAS. Yeah, that's the one.
Yeah. And so
Mm.
I'll hand it over to you to maybe explain a bit if you wanted, because this could come in handy to our parents that maybe or caregivers that just maybe didn't know about it.
Yeah, absolutely, Linda. Thanks for bringing that up. I have actually experienced that myself. Seeing that I have been a bit under the weather lately and thinking, oh, I might have got something on my throat. Um, so of course, test myself for COVID, nothing negative. But then I was thinking, could it be strep throat? And I'm thinking, if I'm gonna book with my GP, it's gonna take forever. And I know that sometimes, for everyone who might be experiencing it, takes a while for you to actually get seen by the GP. So I thought I'll ring my pharmacy just in case. They might be able to give me some advice. And the pharmacist actually told me that you can pop in and we can do a throat swab for you to check if it's strep or not. So I
Mm,
know that there are some pharmacies who do that. So it's not just like, I was a bit curious and I asked, do you only do like throat swabs and things like that? And the pharmacist was quite helpful and she said, well, actually, we don't just do the throat swab. We can also give you some, bit of advice or guidance on what would be good for you if that's what you need. Like
mm,
say I was asking the pharmacist about like what can I use? Can I use a nasal spray or whatnot and things like that? And they're quite helpful when it comes to giving you some advice and guidance on what do you actually need for like minor ailments. I mean, you wouldn't go there for, something
mm.
major, but like the cough, the colds or allergies, skin issues, things like that, they can
Yeah,
actually give you a bit of an advice. I think even minor wounds or cuts,
yeah,
they might be able to give you some advice or guidance on that as well. Yeah.
definitely.
Mm,
It's a fairly new thing, and one of our producers have just actually plopped the link down below if anyone wanted to go into that. And so basically, like you said, Rosalind, it is quite tough to get in, especially around this time of the year. My GP's 3 week wait as well. And
Yeah.
especially with your little ones, you need them probably seen to quite fast. And so a lot of people are having to go to the urgent care, and it is a couple of hours of wait. So if they do have probably something a bit minor, that's another option for people to go
Absolutely.
and get them seen and get some advice around it. So have a look
Mm,
in the comments for that link, and it'll give you kind of all the criteria and also the areas of New Zealand where they offer this. Um,
mm,
yeah, which is absolutely fantastic. I know Auckland is one of them. So,
yeah.
if you're up in the big smoke, yeah, it might be something helpful for our caregivers instead of waiting in
Yeah.
urgent care for a few hours.
Absolutely,
Yeah,
absolutely.
yeah.
And they're really quite helpful
Wonderful.
as well. I guess another thing to consider to Linda is give them a ring first before you turn up, because sometimes they might say, oh, we're quite busy at the moment. This is our busiest time
Mhm.
of the day. You might need to book in, rah, rah, rah. So give them a ring first just to be
Yeah.
sure as well. Yeah.
Awesome. Oh, sorry, Rosalind. We have got
Hmm,
another question. So I might read that out if you don't mind.
that's all good.
Um, we have a question from Jess. She is talking about dummies and
Hmm,
sterilizing. So obviously meant to sterilize dummies anyway, but if you've got bugs in the family or they've got, bugs from daycare just started, is there should we increase the sterilizing or keep it the same? What's your
hmm.
thoughts around that to kind of minimize bugs?
Generally speaking, parents should sterilize feeding equipments. And when I say feeding equipments, anything that touches the mouth, basically, or say if you're breastfeeding or expressing, things like that, at least 6 months old. So if your child is under 6 months old, that's when we would advise to sterilize things and dummies. But thanks
Mm,
for the question, Jace. Now, the how frequent are you going to be sterilizing the dummies and whatnot? I guess sometimes it's more like a perhaps a bit of a parental prerogative, like say if the dummy's been
mhm,
in your little one for a long period of time and he or she keeps dropping it off on the floor, then of course you would want to clean that more often. And depending on how old, like what I said, 6 months and under, we would still sterilize them more frequently. But 6 months and above,
mm.
um you know their immune system is already building at that age, so we can get away with just a normal washing it off with your soapy runny water, so that should be okay, 6 months and above. Yeah.
Great. Oh, it's good to have kind of a bit of a uh, age or guideline around that. Thanks, Rosalind.
Mm,
So
no
let's say
worries.
you've got a peppy that is younger. You might still be breastfeeding them.
Mm,
If you are sick yourself, what
yes.
is, possibly if you are sick with a bit of a cold and you need to take something, is there any recommendations around safe medicines for mama to take while breastfeeding?
Mm,
Watching out for Peppy at the same time.
yeah, no, again, I guess as a registered nurse, it's out of our scope of practice to actually
Mm,
um you know advise medications. However, of course, our paracetamol is there, so that's still safe to use
mm,
whilst breastfeeding, as long as you're not allergic to any medications. Um, and if you're wanting more, I guess, of a home remedy, say for example for colds and flu, and you're not allergic to anything, you're generally well yourself apart from the cold and flu symptoms, you can actually have something like your usual lemon, honey, ginger mixture, or a bit of
yeah.
a warm tea. Mix it with a bit of lemon. That's probably a bit more natural remedy that is very, very safe for breastfeeding. But if you are more kind of interested in a medication, say for example, a particular product or brand that you've already got or purchased from the chemist, and you're not sure if you can take it or not, Again,
Mm.
our PlunketLine nurses, we have got a resource on hand that we can tell you whether it's safe for breastfeeding or not. So you can give us a call as long as it has been recommended by your GP or your doctor. Check with the chemist, and it's not the first time that you're gonna be taking that particular medication or treatment. Hope that answers that question.
Awesome. Oh, and I've just seen we have got the PlunketLine phone number there. So if you don't have our handy little fridge magnets, then there's some there. But if you do want the handy fridge magnets, pop into the clinic and they should have some there for you. Um, and magnets are always super helpful. Oh, that's awesome, Rosalind. Thank you for that. I mean, you talked about PAMO, and everyone, for our peppy, everyone thinks of the PAMO. I do know there's some restrictions, obviously, about how much you can give
Mm,
to
yes.
your children and things around that. Can you talk to us a bit more about that, do you think?
Yeah, absolutely, Linda. I guess when it comes to paracetamol, 3 months and above, if we know that they have been prescribed by their GPs, or of course, we've got also nurse practitioners. Um, so if they have been prescribed, as long as they are prescribed, then we can give them the correct dose at the correct time, and it's usually no more than 4 doses in a 24-hour time frame. So you can give it to them if you have to give it to Pippi, especially if they've got a high temperature, they're very miserable, every 4 to 6 hours if needed, but you don't need to like do it round the clock. If you think that your
Yeah,
puppy's actually coping well, then you don't need to
yeah,
do that round the clock just when they need it, because their kidneys are also still quite vulnerable. So and we know that paracetamol is the number one killer, not just in New Zealand. So we are really, really quite careful on dosaging and giving our puppy paracetamol.
yeah, right. And there is actually a personal question I want to ask about
Sure.
parents for my own children, because I'm not 100% sure. And I thought, well, I got you here. So let's say you've been giving your Pepe or Tamariki Pamol, and then you want to
Mm,
swap to ibuprofen. What's the rules around that? So do you
mm.
swap and then you stay on ibuprofen? You don't swap
Yeah.
back. Yes.
Yeah. I guess for you, Linda, and I'm sure that this is already prescribed for your for your little ones. Usually you can swap them, or with the
Hmm.
guidance of the GP, you can give them together if it's really, really needed, when it's really necessary. Some GPs would say do them together. But
Right.
as registered nurses, we always say, to make sure that you are giving them at least an hour or two apart. So you've got something to cover for that whole 24-hour time frame. Because some parents would say, we've given some paracetamol, it's not working. What else can we give? Can we give them ibuprofen? And if they have had ibuprofen before, again, depending on the age of the tamariki and if it's been prescribed by the GP, yes, you can. You can alternate them. I think that's probably the best way to do it. Alternate them so you've
Hmm.
got something to cover for the whole 24-hour period, and making sure you take down notes, you list the medications that you have been given so you don't overdo it. Because with ibuprofen, it's only 3 doses in a 24-hour time frame, as compared to your
Hmm.
paracetamol, which is 4 doses in a 24-hour time frame. So you're more giving the ibuprofen every 6 to 8 hours if need be.
Right. Yeah.
Mm,
That's really handy to know. Awesome.
yeah,
Thank you.
that's all right.
As parents, you always think, is this correct? And when in doubt, like you say, you can always call PlunketLine, which is really reassuring.
Absolutely.
If it's in the middle of the night, you're not 100% sure. um,
Yeah.
yeah, we actually have a bit of a question here from Marie. My boy has been on and off with the cough. It seems
Mm.
like a lot of phlegm behind his nose and throat, sometimes making him vomit. Is there
Mm.
any advice as such?
Mm. Poor Baba. Um, I wanted to ask how old is your little wee boy, because usually my advice sort of depends on how old is the baby. But in general, um, if our tamariki has got cough symptoms and the phlegm is sitting behind the throat, makes
Mm.
him vomit, actually let them vomit. Because the thing is,
Right.
I mean, not like, not like forced vomit, but the vomiting can actually give them much relief and comfort from that if it's sitting on the throat. Because coughing, in actual fact, coughing is a defense mechanism. It's a protective response for little ones to actually get rid and expectorate that phlegm that's sitting at the back of the throat.
Mm.
You might notice that after vomiting or spewing that phlegm, they might feel better. Of course, it's not nice
Right.
seeing them do that, having
Yeah.
that coughing spasms and then vomiting afterwards. Not very nice. It's not very nice, but it
Mm.
can help them. It can help them clear that congestion away. Now,
Right.
the thing with that is, of course, we need to help them get rid of that phlegm, that secretion. So, again, lots and lots of extra fluids to actually loosen that phlegm there. Um, whether it's breast milk, whether it's formula, whether it's cold boiled water, lukewarm water, or a bit more of a colder water, because sometimes colder water can actually soothe the throat and numb the pain. So
Mm.
either of those will help them loosen that phlegm out. Um, and for older pepi or for older tamariki, um, we also can do a little bit of a back tapping. I've done that a few times with my little ones. It may help with you or with your tamariki, but it's worth a try. So on your back, say for example, this is my back. You can do like a
Mm.
V tap, like you can tap their back in a V manner. So just cup your
Okay.
hands like this and patting the back. So just on your back in between your shoulder blades. So like in a V
Ah.
manner. So for babies or older toddler age, you can do a bit of a back tapping, and that also helps loosen or clear the phlegm away. And by rubbing your hands or your palms together, making them nice and warm, massaging their back, whether with a bit of an oil. Again, for older babies, I wouldn't advise that
Mm.
for younger somebody because their skin can be quite sensitive. So warming your hands, massaging their back or their chest area, that can also help
Right.
sometimes with the congestion. Yeah.
Oh, that's awesome to know. And definitely, when it's really early in the morning, you'll just try just about anything, especially if it's natural, just to give them a bit of relief and from the discomfort. Because as a parent, you just want to take all the pain away from them. So if
Absolutely.
there's something you can do, that's an awesome tip, Rosalind. We do have another question from Esther
Hmm.
about runny noses.
Oh, cool.
So tips for runny noses for kids while at daycare.
We have touched it a little bit earlier. However, I think
Mm.
I may have not talked about like tips on like runny noses, say like the use of your snot suckers, your
Yes.
saline drops, the sprays, gosh, name it. There's quite a few things in the market now that you can actually use to help
Mm.
ease this runny noses. And of course, you're probably one of those moms like me who fancies running around the house, holding your tissues, wiping their noses off, and all that stuff, especially if they don't know how to do it themselves yet. Um,
Yeah. Yeah.
yeah, so basically, your saline drops or saline spray is really quite good to ease with runny noses. Some would think that, oh, they're just quite good with black nose, but why are you advising it on runny noses? They can actually work as well, even for runny noses. Um, because what it might do is it might sort of dry the nasal mucosa or the nasal lining, and that might stop the
Mm.
runny noses for some kids. However, again, with saline drops or saline sprays, always read the label, because I'm pretty sure that there's
Mm.
only a maximum that you can do it, like 4 times a day as well too, because it can
Right.
dry the mucosal lining too much sometimes, which can cause
Mm.
a bit of a nasal bleeding. So sometimes we get the odd calls about my baby's just got a bit of a runny nose, and then the snot has came out with a bit of blood. So that might be the case at some
Right.
point. Yeah.
And so this saline solution you can just get over the counter from the
You
chemist.
can
That's
get,
correct. Yeah.
yeah, You can get that over the counter from the chemist, or for younger babies under 3 months, sometimes we say either talk to the midwife. Sometimes the midwives can give them some saline drops as well. Yeah, if they haven't got them handy yet. But yeah, over the counter as well. If you don't have it at home, I wouldn't recommend making your own, salt water solution at home because sometimes we don't get it right. Even if we know that we are quite
Yes.
good with our measurements, we always don't get it right. And we don't want to poison them with too much salt or too much water up their nose. So instead of instead of the saline drops, if you don't have it at home yet, say it happens in the middle of the night and you don't have any access to pharmacy and whatnot, cooled boiled water works fine because we know that cooled boiled water is sterile. So you can use that as well as a nasal drop. So just 1 to 2 drops on their nostrils. You don't need to like
Yeah.
use a huge amount. So just 1 to 2 drops on the nostrils. And what it might do is it would either soften up that snot, they'll sneeze it out, or sometimes they'll swallow it back down and it might end up being coughed out as well. So that's what it can do. Or even your breast milk for moms that are breastfeeding. You can also use your breast milk as a nasal drop as well.
Yeah. Breast milk is
Mm.
amazing, isn't it?
Yes, yes, it
You
does
can use it
huge wonders.
I
Yeah.
didn't know how many uses they had until I become a mother.
Yeah.
And talking about, you mentioned the snot sucker, and I actually, because I have a little one, I still have one. And so for the people that possibly haven't had to use this or hasn't seen one, this is kind of what they look like.
Good on you.
So it is a
Yeah,
bit of a balloon,
like a ball
and you
bag.
can,
Yeah.
yeah. And so it sucks the snot back in there, and then it's got a bit of a lid. So you can get them at the
Perfect.
pharmacy. Yeah, sometimes
Mm.
they're a bit helpful. I've just looked at the time. And so if anyone has just joined us, we are giving away 2 Dettol packs from our partners. They have antibacterial wipes, floor wipes. You've got your hand washers, all sorts, bars of soap and all sorts. So if you did really quickly want to enter that draw, you will have to put in a comment below, and our producer will pop it up hopefully. And at the end of this, we will draw 2 winners. So yeah, quickly pop a question down below. I am just thinking, we haven't really touched on, we've got the PlunketLine, so whenever you're in doubt, call that one and they'll give you a bit of
Yep.
guidance. But is there anything in particular we should be looking out for on our
Mm.
tamariki in terms of like rashes or any kind of things that maybe give us a bit of an alarm bell to go, we need to go to urgent care tonight, or yeah.
Mm-mm. I guess your danger signs I typically, of course, if they're starting to become unwell with anything, like cough and colds, basically, yes, we know that they're already unwell. But I also want to also, check your ABCs, baby's airways or breathing.
Mm,
Is there any sort of difference with the sound of the breathing that they've been doing? Or how's their behavior been like compared to usual? Are they more lethargic, floppy, drowsy, very irritable, more than
mm,
what you would expect them? Or how are they looking like when it comes to their circulation? Is he looking mottled, bluish, or very pale? So those are the ABCs that usually I would say, okay, let's take them off to ED straight away, or let's ring an ambulance for you. And again, that's
mm,
of course, PlunketLine 24/7 if you're not sure. But those are the danger signs that you would want to keep an eye out for, rashes. So basically, that's your C, your circulation. Dehydration. So you also see that on your C's. So dehydration, if their lips are looking quite dry, they haven't got any wet nappy within a 6-hour time frame, um, and changes in their breathing pattern. So those are the things that you would
mm.
want to include in your danger signs. So always check for your ABCs. Yeah.
Right. That's awesome to know. And like you say, that the PlunketLine kind of triage as well.
Yes.
And if it's early in the morning and you just can't really think, um, then it's great to call, and then you guys can ask all those questions and determine whether or not we need to go to urgent care or call an ambulance and get that help. So
Absolutely.
when in doubt, PlunketLine is there.
Yeah.
We have another question, if you don't mind, from Kayla saying a chest infection is treated with antibiotics, but how does a virus change to a bacterial infection?
Oh, that's probably a bit of a tricky question for me to answer, Linda, to be honest. Um, I may ask for an apology for Kayla regarding how a virus changes to a bacterial infection because I actually don't know the answer to that. Um, I haven't been a pathologist, and that might be beyond my pay grade. But yeah, unfortunately, I am not um, able to answer that question for you, Kayla. However, we might be able to share some link and information on how a virus
Mm,
changes to a bacterial infection as well at some point, especially from the Ministry of Health website. Yeah, because I think sometimes viruses can change to bacterial infection depending on, um, like say for example, if a doctor orders a swab or test them with something, they'll culture that swab and that's how they'll figure out if it is indeed turning into a bacterial infection. It will grow,
mm,
that swab will grow into some pathogens, which they will then know that, oh, yes, it's not just a virus itself, it's actually becoming a bacterial infection. Yeah, hope that makes
yeah,
sense.
yeah. No, that's great. I think as a parent, you do sort of sometimes think of putting
Mm.
on your science hat on, going, I wonder about this, and you get really curious.
I was imagining
Um,
of the petri dish and the microscope when I
yeah,
was answering that question, Kayla.
but it's a good question, Kayla. Really good.
Thank you.
Probably one of our hardest ones tonight. Um, yeah, that's great. So, I guess what we haven't touched on is, we kind of touched on it a little bit in terms of self care for us. Anyone that's looking after, Pepe and Tamariki, it is tough work. And if you're doing it, you're not having a good run and you're doing it for a few days or a few weeks, it can get tough and long days. And is there any self care to make sure that we can keep going
Yeah,
as caregivers,
yeah,
that you would
yeah.
recommend?
I guess number one is your basic hand hygiene, that hand washing, keeping hands out of mouths where possible, cuffing to your elbows, or possible, wiping surfaces or toys, and also having a good balanced diet. Easier said than done, especially when, prices are all up. But yeah, sometimes we need to be a bit more sort of mindful on the food that we're actually feeding our body because you are what you eat. And
Mm,
if you know that you're already unwell, isolate where possible. You don't want to be spreading that
yeah.
bugs and viruses to anyone. We have been very good at masking. So put on your mask. If you're not well yourself and you know that you might be able to give something to someone else, so put your mask on. And of course, immunization. We want our parents to have, a very an informal choice when it comes to immunization. And flu
Mm,
shots are now free for under 12s. Um, and of course, your MMR or new meningococcal vaccine. We're popping the links through for immunization advisory center as well. So all our parents will have informed choices on this when it comes to immunizing.
mm,
And of course, as parents, as caregivers, we want to make sure that we also look after ourselves, meditation, mindfulness for parents, so looking after ourselves so that we can also give our, I guess, 99% best
yeah.
for our little ones. Yeah.
Yeah. Oh, that's fantastic. And yeah, the link is down there if anyone wants to have a wee look. See, um, I guess as well, like mum or parent tips or caregiver tips of, sickness, it's unavoidable. It will happen at some
Mm,
point. And I know that having my two, I've learned just to keep something quick in the freezer, if that's a home cooked lasagna or something in the freezer. So
mm.
if sickness does hit, you've got some backup where maybe you're still getting the nutrition that you need to keep going.
Perfect.
So yeah, so you learn all tricks of the trade in it. I have just read we have got one of our winners. So I hope everyone's ready. Hopefully they're
Ta-da!
Oh, I'm sorry. I'm just reading the second one. So we did have 2 prize packs from our awesome, really generous partners, Dettol. The first one is actually the really tricky question, Jess. So Jess asked about the sterile. Oh no, that was Jess. We did Jess's, didn't we?
Yeah.
Yes. That asked about the sterilizing of the dummies.
Yes, that's the
So
one.
if you are there, Jess, please do message us to kind of get your details and we can get that to you. And we did have a second winner. So, drum roll, it is Catherine Eastman. And she asked about her 1-year-old starting daycare and preventing sicknesses. So hopefully the answer was very helpful. But yes, please do message through, Catherine, and we will get your details and the prize pack sent out to you. And if you did want to have a look, see what that was again, it is on the stories on my Instagram. So thanks everyone for joining us. I personally have got a lot of knowledge from this myself. So thank you so much, Roscelyne, and everyone at home that has joined us tonight. It's been great.
Yeah, no, thank you, everyone. And my apologies if I haven't answered all your questions. I know that questions are still coming through. But like what I said, you might be able to talk to me over the phone at PlunketLine. We are 24/7 service anyway, so give us a bell at 0800 933 922, or I might have actually spoken to any of you who are commenting right now. Yeah, and thank you so much, Linda. It's a great opportunity to just share my nursing knowledge to our tamariki, to our Whānau here who have been, I guess, not the best, especially with their winter bugs and illnesses. But I think, everyone deserves a pat on the back for being well, especially this winter season. Thank you so much for joining us.
Oh, thank you, everyone, and stay healthy. See you, everyone.
Rakite.